Hello everyone, welcome to the first episode of our breast surgery series. My name is Yasaman Hemmatlu and today I'm going to talk about different types of cosmetic breast surgery. Breast surgery as a cosmetic procedure for women can be divided into four main categories: breast augmentation, breast reduction, breast lift, and breast reconstruction. So what are these procedures for and how are they different? Stay tuned to find out. Breast augmentation, otherwise known as augmentation mammoplasty, and also colloquially referred to as boob job, is a procedure for enlarging and enhancing the shape and contour of the breasts, to put it in simplest terms. It is a widely popular cosmetic procedure which has gained a lot of popularity over the past years, topping the list as the #1 most popular cosmetic surgery in the United States in recent years. Breast augmentation is sought by women for different reasons. Some women may feel unhappy about the size of their breasts and think that they are just too small. Some others may have had a volume loss due to aging, pregnancy, or lactation, which is the milk production process. And a smaller group may want to correct an asymmetry in their breast size. Augmentation mammoplasty can be done in 3 different ways: breast implants, the most common technique, fat transfer or fat grafting, and dermal filler injection. The first and most important type of breast augmentation is using breast implants. Breast implants are prosthetic devices either completely made of silicone or having an outer silicone shell and filled with saline or salt water, and come in different shapes and sizes. Silicone breast implants are the most common type of breast implants. Breast implants are placed into the breasts with 2 techniques. The first technique is placing the implants under the breast tissue but on top of the pectoral muscle, which is called subglandular placement, and the second one is placing them beneath the pectoral muscle, called submuscular placement. One of these implant placement methods is usually preferable to the other depending on your anatomy, preferences, lifestyle, and the type of implant you choose. The second option to enhance the size of the breasts is fat transfer or fat grafting, also known as lipofilling. Fat transfer is a body contouring procedure that involves removing fat from the patient's own body and injecting it into other parts of the body that need augmentation. One of these areas is the breast. Using fat injection for breast enlargement is a good alternative for women who want to add a little bit of volume to their breasts while at the same time getting rid of their excess fat to have a slimmer body. So you shouldn't expect that a fat transfer breast augmentation increases the size of your breasts as much as a breast implants procedure would do. The third way to augment the breasts is dermal filler injection. Injectable dermal fillers are gel-like substances such as hyaluronic acid that are injected under the skin to enhance the appearance of the body by smoothing the wrinkles and creases and increasing the volume of the recipient areas. Augmentation with fillers is the least favorite among all types of breast augmentation procedures because it can cause complications if it's injected incorrectly. Additionally, the results of filler injection are temporary, typically not lasting more than 18 months. Okay, now you know the different types of breast augmentation. Keep watching to find out more about other breast surgery procedures. Another highly popular breast procedure is breast lift, which is technically referred to as mastopexy. Unlike breast augmentation, breast lift is not intended to increase the volume of the breasts. Rather, it improves their shape and gives them a more youthful appearance. In other words, it lifts up and tightens saggy breasts, making them firmer, shapelier, and more perky. Age, pregnancy, breastfeeding, genetics, weight and hormone fluctuations, and some illnesses are factors that can cause breasts to sag and lose their firmness. So it's easy to guess who the candidates for breast lift are. Breast lift is done by making incisions on the breast, removing excess skin, tightening the underlying tissues, and repositioning the areola and nipple. Depending on the severity of breast sagging and the size of the breast, surgeons use different techniques and different incisions to perform the procedure. Breast lift and breast augmentation can be done together. That is to say, you can both have your breasts lifted and get breast implants or other augmentation procedures to increase the size of them at the same time. As opposed to women with too small breasts, on the other side of the fence there are women who have too big breasts that are disproportionate to their body. Overly large breasts can cause physical and psychological problems for women, such as neck and back pain, discomfort, and a lot of insecurity. Oversized breasts can also limit a woman's choice of clothing and her ability to engage in some exercises and activities. Breast reduction surgery or reduction mammoplasty is a cosmetic procedure that aims to decrease the size and weight of the breasts. The surgeon may use incisional and liposuction techniques to remove excess fat, tissue, and skin from the breasts. The areola and nipples are usually repositioned in a reduction mammoplasty. Sometimes they're completely removed, then reattached and repositioned, and sometimes they're not removed to be repositioned. By and large, breast reduction can make a big difference to your life, and the majority of women who have had this surgery are satisfied with the results. There's a fourth type of cosmetic breast surgery which is a little bit different from those we mentioned earlier. This type of cosmetic breast surgery is breast reconstruction, and it's done to restore the shape and look of a lost or damaged breast, usually performed for breast cancer patients who had mastectomy, meaning they had their breasts removed. There are two main techniques for breast reconstruction. The first one involves using the patient's own tissues, including skin, fat, and muscle, to rebuild the breast. This kind of procedure is referred to by different names, such as flap procedure, autologous tissue reconstruction, autograft, and autotransplant. Another technique is using breast implants, just like in breast augmentation. A combination of both techniques is also possible. Breast reconstruction can be done immediately after mastectomy or sometime later. Okay, that was all for different types of cosmetic breast surgery. In other episodes of this series, we'll discuss each of these procedures in detail. So please subscribe to our channel down below to never miss our new videos. You can also visit our website at AriaMedTour.com and follow our Instagram to know more about us and our services. Thanks for watching, and goodbye for now.